Sanırım öteki diğer oturumlara saklıyorlar sorularını panelistler.
Biz hızlı bir giriş yaptık Bahar Hocam. Ben de öncelikle Kongre Düzenleme Komitesi olarak başlıca size çok teşekkür etmek istiyorum. Çok güzel gidiyor ve gerçekten çok aydınlanıyoruz. Çok güncel konular. Özellikle size çok teşekkür etmek istiyorum. Ayrıca bütün organizasyon komitesindeki arkadaşlarımıza. İkinci konuşmacımız Doktor Cindy Duke, Las Vegas Tıp Fakültesinden, bilmiyorum bağlantıda mı?
Yapmayı da planlıyoruz dernek olarak, Hemut ve SOHE olarak. Çünkü geleceğin tıbbının iddiasındaysak bunu devamlı süregelen hale getirmemiz lazım. Belki saatlerimizi biraz daha dünya ile, özellikle Asya ve Amerika ile ilgili saat problemi yaşadığımızda, bundan sonrakilerde belki biraz daha belki onların oturumlarını saate alarak yaparız diye düşünüyorum. Teknik ekipten bir bilgi gelirse Sayın Dük'ün konuşmasının online'ına dair.
Hocam Doktor Cindy Dük canlı katılacaktı fakat şu anda kendisi gelmedi. Telefonda da asistan arkadaşım.
Was about
Geçelim.
Sayın moderatörleri.
Tamam.
Evet.
O zaman
Emine
İlay
Hanım.
Gözükara Hoca'nın sunumuna geçiyoruz.
Evet. İlay Gözükara'mız ART'ta gelecek beklentileriyle ilgili bir sunumu yapacak bizlere. Kendisi burada mı?
Ilay Well, we have her video presentation. Okay, then we can have this.
Hi, this is Gözkara from Turkey. First of all, I would like to express my pleasure to organizing committee and Dr. Bahar Uslu for such an exciting congress. And I will try to talk about our future expectations in ART cycles. There are some troubles during IVF treatment, even though advances, and I want to talk about most common ones: embryo selection, advanced maternal age, and fertility preservation. The selection of viable embryo remains a principal challenge of IVF. This is essential in order to predict live birth, and maybe in the future artificial intelligence will help us in this trouble. And what is the artificial intelligence? It's defined as the use of complex algorithm in order for machine to perform cognitive functions, including problem solving and decision making. There are studies about this topic, and in one, Zanovich reported 10,148 embryos with 5,392 time-lapse images reviewed, and 97% accuracy in discriminating between a poor and good blastocyst was. Besides embryo, using pretreatment characteristics of known cycles to predict first cycle success had an accuracy of 81% in other study. Another important topic is advanced maternal age, and it's a critical social and clinical issue. Currently, the proportion of women delaying childbearing until the late third and early fourth decade of life has greatly increased because of increased education, career goals, and women employment. Women older than 35 years experience a dramatically increase in embryo aneuploidy rate from 30% baseline production up to 90% in their 40s prior to menopause. This can be attributed on the one hand to the gradual depletion of ovarian reserve, on the other hand, progressive decrease in oocyte biopsy is offered to the patient to exclude aneuploidy. Even if it's a safe and effective procedure that requires embryo manipulation, experienced operator, and higher workload for laboratory. Therefore, a request for non-invasive approaches to conduct embryo selection started in IVF. Several groups investigated leftover products of IVF for their content in proteins metabolism. Of the events and interaction of cellular structures and metabolomics. Slide all these practices have been described mainly in small proof of concept studies and in young patients. Scientific, medical, legal, and ethical implications exist for all these technologies. Only then germline engineering could be considered for any clinical use in humans, either for preventing inheritable disease such as mitochondrial disorders or as an option to find as correction of aneuploidies in living cells. Find direct application in the chromosomal disorder of aneuploid germ cells and embryos in IVF. There are recent studies showing that chromosome therapy is possible. This is the schematic view of aforementioned topics before fertilization, chromosome therapy, spindle transfer, and mitochondrial transfer, and after fertilization, again chromosomal therapy and pronuclear transfer. It may be possible to generate new gamete cells from stem cells in the future. It was reported that myelin-induced pluripotent stem cells were differentiated into functional oocytes in the presence of specific growth factors. Studying oogenesis in mouse ovaries, the authors reported the presence of mitotically active oogonial stem cells capable of generating new oocytes that can be fertilized to produce viable offspring. Two strategies have been theorized. Firstly, the isolation of oogonial stem cells from ovarian biopsies of the infertile patient and then trigger the formation of new oocytes by either transplanting them back in the ovary or performing IVF. Secondly, the isolation of somatic cells transformed into induced pluripotent stem cells and then finally differentiated into new oocytes. Of note, all these future therapeutic strategies are still experimental and raise biological, genetic, and technical and ethical concerns. Recently, oogonial stem cells collected from fresh ovarian cortical fragments of non-menopausal and menopausal women are able to differentiate into large haploid oocyte-like cells and enter meiosis under appropriate culture conditions. In Another study in 2018 have reported that infertility rescue and ovarian follicular growth can be promoted by bone marrow stem cell infusion in mice. This provides another possible alternative to improve follicular development in aged women or to preserve fertility in oncological or poor responder patients. Another important topic is fertility preservation. Today, by age of 39 years, one of every 50 women will have been diagnosed with cancer, and anti-cancer treatment results with ovarian failure. So some future fertility preservation methods can be needed, like some new gonadoprotective agents, also some new drugs to improve tissue grafting. Artificial ovaries containing isolated follicles and culturing primordial follicles to mature oocytes might serve as a revolutionary method without the danger of cancer residing. I'm coming to my last slide. So maybe we will not see any pregnant women in the future. Even we will not see any children with syndrome and congenital diseases in the future because of some advanced new technologies. And with a precise understanding of the environment of embryo together with fetal development, maybe the laboratory environment will be completely identical to the in vivo environment, and as a result, the fetus will be grown in vivo until birth. Thus, we will not see preeclampsia, gestational diabetes mellitus, and many other risky conditions that we see during pregnancy. Perhaps in the future, we will be able to heal and purify all diseases in DNA with genetic engineering and chromosome therapies. This is our team at the entrance IVF Center. It's located at the southern part of Turkey, Adana. This is our chef, Dr. Çetin. These are our embryologists, Zeynep İlker. This is Dr. Yusuf. We are working together, and nurses and other staff. And in this room, we take history of patients, and beside this room, we examine patients with transvaginal. These are our embryologists performing ICSI and also daily embryo control. Biopsy, TSE, piezoelectric stimulation, ROSI technique for azoospermic patients, microfluidic chip application, ovarian injections, embryo freezing, gamete and gonadal tissue freezing, all operative hysteroscopic surgeries that is connected with laboratory, and the other one is for hysteroscopic surgeries. And lastly, this is a night view from Adana. I hope to meet face to face in new Congress, and I wish everyone healthy and COVID-free days. Thank you for your patience.
Biz teşekkür ederiz. Adana'dan katılan doçent doktor İlay hocamıza tekrar teşekkür ediyoruz.
Emin hocam,
Thank you very much.
Sunumundan dolayı. Buyurun Betül Hanım.
ben biraz geç bağlanabildim. Yine
Evet.
kusura bakmayın.
Let's get connected only a little late. Let me introduce myself. I'm Specialist Dr. Betül Sarı, Health Sciences University, Istanbul Research and Training Hospital, Süleymaniye, Obstetrics and Gynecology Department, IVF Center is where I'm actively working. İlayda Hanım's presentation is finished, but let me give you some brief data information on that. İlay Gözükara, Associate Professor İlay Gözükara has completed her graduate study in Hacettepe University, and then in Mersin University Faculty of Medicine has completed her postgraduate study, and right now is actively working in Turan Güneş Obstetrics Hospital. But I think she's not with us. If she was with us, I'm sure that she would be able to fulfill your questions answer your questions right now. Still, you may ask your questions because this session will be open to anyone 60 days. I'm sure your questions will be answered in the meantime, but I would like to pass on to the next speaker now. The next speaker is Associate Professor Deniz Sakar, a very valuable colleague of ours. She studied at Çukurova University and then in histology and embryology department. She received her specialization right now in Adana City Hospital, Research and Training Hospital. She is working in the Department of Andrology. I'd like to give the words to Associate Professor Deniz Akasatar right now. I would like to add something, if you would allow me, to welcome distinguished Madam Satar has her husband supporting her. I see each successful woman is being supported by a supportive man. Can we say that? Yes, of course. I have problems in managing my PC. My husband is going to help me. If I have any problems with my PC, I'm going to share screen and then we'll start with my presentation.
Bunu nasıl tam ekran yapayım? Bir dakika. Öncelikle Bahar Hocam başta olmak üzere sesim geliyor değil mi?
Well, first of all, I'd like to thank everybody, mainly Bahar Hanım and the other members of the organizing committee. I'm going to talk about new trends in andrology. As you all know, the embryologists mainly deal with
için bir dönüm noktasıydı. Louis Brown'un doğuşu tüm gazetelerden
and the birth of Louis Brown was also a turning point. This is Louis Brown at the age of 40, and you can see an incubator, which belongs to that period, that is a distillator. Male infertility treatment has gone through a revolution with ICSI. After ICSI, male sperm cells were obtained by new methods, and this has become a new horizon. Infertility actually means lack of conception following 1 year of unprotected sexual intercourse. It affects approximately 15% of all couples. 30% has 30% is male factor, 30% female factor, 30% involve both sexes, and one known has unknown etiology. 30% of all infertility is male originated. As say for analysis, the cornerstone of the male studies. And semen analysis is a good predictor of male fertility. The first protocol for analysis of human semen that could be considered as suitable for clinical laboratory testing came from Macomber and Sanders' study. In 1929, hemocytometry was used for analyzing sperm for the first time. In the early 1950s, a series of investigations were carried out. Macleod and Gold have analyzed sperm and sperm morphology, sperm motility, and sperm count. Related articles started to follow the first studies. So what do we do at andrology laboratories? First, we do the semen analysis. We carry out specialized tests, sperm function tests, sperm DNA fragmentation, IUI, IVF, and ICSI-related sperm preparations, and sperm cryopreservation guideline. WHO published a guideline on examination and processing of human semen. We can check the correctness of those analyses, and we can deliver our results based on that guideline. A fifth edition is dated as 2014. Semen preparation is done by method and density gradient centrifugation. Regarding those methods, the literature includes many studies, and some of with one another, but what is most important is available in both of those studies. Therefore, DNA is not intact. So a better morphology sperm, DNA fragmentation in this sperm are important to us. Therefore, we're using many new techniques.
Ne anlatmaya başladığımda ikisi de normalde spermi 400
Is another method. In ICSI, sperm is magnified 400 times, but in IMSI, this can go as high as up to 6,600 times. That magnification, the head morphology of the sperm is observed much better. Patients can benefit from IMSI if there is severe oligozoospermia, osteonospermia, and teratozoospermia, if there is high degree of DNA fragmentation, if there is history of miscarriage, and if there is previous ICSI fertilization failure, we can easily make use of IMSI system. Microfluidic system is another system which is being used since 2003 method. It is considered both a science technology from genetics to ART. Many areas are being used this microfluidics technology. High motility, normal morphology, and reduced DNA fragmentation are the most important characteristics while obtaining the sperm. Swim up and density gradient are compared to this, and less DNA fragmentation is seen in this method, and in highly motile with nearly undetectable levels of DNA fragmentation. This is our chip, and you see the channels in our chip. We talk about the future. Science and technology is moving so fast that this study carried out by Utkan Demirci in 2020 is also showing us an imaging system which shows how to identify the sperms after a sexual assault. I think we can have new methods following this. The subject is quite wide and it is really difficult to touch upon all items. Omics is the part of biotechnology. It analyzes the structure and also the functions. And omics is coming from Greek. It means being intact. It defines an integrity. Omic technologies are actually technologies which are based on a specific biological material, which is analyzed in terms of genomics, transcriptomics, proteomics, and metabolomics. Therefore, different concepts are involved in the process of omics. This again is talking about seminal plasma, transcriptome, and proteome, and it's titled as Towards the Molecular Approach in the Diagnosis of Idiopathic Male Infertility. And it also talks about patients using ART, benefiting from different molecules, and to justify those molecules, which advanced techniques can be used. And also it says that we need further studies, more advanced studies on a molecular level. Many studies are being carried out, but this is not enough. The specific targets of those molecules should be identified only by future and potential studies to be performed in the near future. When it comes to infertility, the other important subject is the stem cell. Stem cell is an issue which is actually a very important part of finding a solution to the problems of male individuals who cannot have babies. Pluripotent stem cells will be used in the future. Therefore, maybe artificial gametes will be produced, artificial organs will be used thanks to the stem cell studies. Stem cells will lead to all these new developments to take place. Next presentation will also talk about AI, but I'd like to touch upon it shortly as well. IVF laboratory is using AI, and this is a slide which talks about the history of those IVF. AI is being used as a milestone. In 1997, we saw that the chess champion Garry Kasparov, for the first time in the world, was defeated by an AI computer, and it was a milestone, a turning point in the field of AI. About AI and sperm, many other studies are being performed. Morphology and motility and quality of sperm are being analyzed by those studies, which include AI. But the most important setback that of the studies that include AI is that the techniques which are used do not have a consensus, unfortunately. There are many techniques which are being used and tested. Which one is better and which one can be implanted, which one can be used, are not questions which are clearly answered yet. The studies related to those are still underway. For infertile couples, we see something very important. I'm going to read it from the book because I cannot see it from the slide. Advances in assisted reproductive technology for infertile couples were among the great medical successes of the last century. Further refinements of the techniques and modification of treatments will probably occur with ongoing use and practice. Our country is beautiful. Adana is even more beautiful. I'd like to send you my best regards from this beautiful city. That was a good concluding remark. Thank you very much. I'm sorry I had to speak very fast because time is very limited. I hope I haven't made any mistakes. I touched upon the general subjects. All subjects is very comprehensive, and there is literature about all of them. I think it's been useful for everyone. Deniz Hanım, thank you very much. I am curious on something specific. I'd like to ask a question, if you would allow me. You talked about this microfluid method. Andrology's new trends are being followed up closely by everyone, even more closely by me. Microfluid methods, is it a classic, or would you prefer a classic method or microfluid method for selecting sperms? In terms of DNA fragmentation, I believe that the publications you've shown are justifying this, but we as practical clinical embryologists attach more importance and prefer direct observation. Eli Hanım talked about omics too, sperm or embryo quality being observed by a fluid method. Which one would you prefer if you have no other chances at hand? Well, microfluid method, microchip method is a very expensive method. We should put this in the first place. We haven't used it a lot, and the literature that we've gone through is showing that for IVF and ICSI it might be enough, but not for an IVI. Because 20 microliters is the amount of sperm that you can put from the ejaculate into the entry reservoir, but this is not enough for IVU. I would prefer the traditional methods rather than the microchip method, as everyone says, SWIR-MAP or sun or density gradient methods can be adapted to your own study. After working on this for years, the centrifuge level can be reduced with experience. So I would personally prefer to use standard classic method, but my article is also showing that it can be used very effectively, because when it gives the image to the phone on a real-time basis, we see that it can be used for forensic medicine purposes as well. That's okay, but for my own laboratory, I prefer the classic method. I also think so. Let me tell you why I ask this question. This is a big market, and innovation companies, mainly when it comes to selling medical devices, are trying to fuel up the markets, and they have very nice advertisements to influence the directors of the centers and hospitals to sell their products. And manipulations might be there, but now there are certain centers which prefer classic devices. In each symposium I attend, I talk about its disadvantages. IMSI would be okay, but I think selecting the sperm by site is really important. I'm trying to explain this to everyone in all symposiums. Of course, financial factors and social factors are also involved rather than scientific factors. Therefore, unfortunately, the sector is left to the hands of the firms only on some parts. Thank you very much. Our moderators, are there any questions? Do you see any questions coming from the audience? I think there are questions about the presentation. Serkan Bey has a question to the participants. Stem cell potential, cortical fragments can be preferred and surface epithelium can be preferred, but which one is better? Which potential should be preferred from a scientific perspective? As far as I know, Tunica algigenia does not have a stem cell potential other than the stem cell itself. I don't know if you would say something different. Epithelium also does not. The germ cells in the cortex are only in question. If I'm not mistaken, a study from MIT or Harvard conducted by Joshua Jansen has reported that the stem cells in blood, the mesenchymal stem cells in blood, in the ovarium were actually detected. And this was a very critical article. After 10 years, this was approved by the scientific area, scientific circles. We should be cautious, but still we should respect the new ideas because the stem cell potential is complete and really important. I'd like to celebrate the Mother's Day of all my friends who are here today. Thank you very much. Thank you very much for your question. Thank you. So I will continue with my presentation. I think Mr. Ökten will be making the next presentation. Emine Özçınar will make the next presentation, actually.
The next speaker will be Emine Özçınar from Marmara Faculty of Medicine. And in her academic career, she has been to many universities, starting with İzmir University, then Bahçeşehir University, and now in İzmir Tınaztepe University. Well, she has acted as the founder of many IVF centers, both in public and private centers. Let me say a couple of words. She's very valuable for us, particularly for IVF circles. She has assumed many responsibilities. She is active also in our association as an active founding member. So I would like to congratulate her. And also she has established many departments in various universities. She is educating many valuable students. Okay, thank you very much. Well, she's going to talk about using of artificial intelligence in assisted reproductive techniques. The floor is yours, ma'am.
Yardımlı üreme tekniklerinde yapay zekadan bahsedeceğim.
Well, I'm going to talk about the use of artificial intelligence in ART. I'm going to be quite quick. So even if I summarize, it can be more than 10 minutes. So I'm going to start my clock. But let me first tell you this. I tried to scan the literature as much as I could, but I was disappointed because I saw that artificial intelligence was not used very much in IVF. Still, some manual practices are performed. Well, Deniz already showed some of the artificial intelligence used in ART, but first artificial intelligence was coined in 1956, and it was in use in various fields, including medicine. And through time, the knowledge accumulated in database. And also, they started to collect that information from many databases, from records and everything. So the use of artificial intelligence extended in various fields. Of course, it's not going to replace the medical team, but it eases their work, particularly in ART and in many fields. There are some areas that we face challenges. I believe that artificial intelligence is going to be guiding. In the next session, you will discuss artificial intelligence, so I'm looking forward to that session. But I have seen that the AI is not very much used in the ART. When we look at the doubling rate of medical knowledge, in 1950s, it was 50 years. In 2010, it was 3.5 years. And in 2020, it is only 73 days. So with all this information, with all this knowledge, a physician needs to make a correct decision, but it is quite difficult. So AI is a must in decision-making processes in medicine. So starting from 1936, then to 1990s, it has developed a lot, and particularly after 2000 and 2010, it has become very popular. But when it comes to the ART, in 1978, we had the first live birth in IVF. In 1999, Gartner classification was developed, and in the year 2000, I started my IVF education, and we were using Gartner classification, and we are still using this. So we are using quite subjective characteristics in our IVF practices. In 2001, we had the pregnancy out of first cryopreservation, and in 2004, first single embryo transfer was accepted throughout the world. There is one more problem. Well, we are going to make a single embryo transfer, and we are going to increase the success. Of course, technological developments took place, media were developed accordingly. So many advanced technology equipment are used, but the storage of this knowledge and information and making them available was not possible. And together with time lapse of Microsoft in 2013, things started to change. The embryologist select of oocytes and sperms were quite subjective. Therefore, evidence-based sources are not very much used. And with time-lapse microscopy, the culture techniques are started to be standardized, and optimization of embryo selection started using some new techniques. Some steps have already been taken, we should say. However, in ESHRE, ASRN, there were some workshops that were organized. The information and knowledge should be shared. But of course, that information and that knowledge should be of high quality. So experts should share that information. If we can share that information, and if we can make that information available through AI, then the success rates will be quite high. Right now, we base ourselves on the experience and knowledge of the embryologist, and it is quite subjective. And there is also the easiness that we use. So it does not create great problems, at least patients with certain factors, but there are still challenging cases. There are some unexplained infertilities. They are in the gray zone. So with the big data, we can have access to lots of information. We have electronic medical records, hospital data, and also we have social environment, cloud data sharing. So if we can use them as inputs to artificial intelligence, then we can use them in like robotic surgery, outcome prediction, what kind of an embryo can be collected, can be produced from what kind of sperm and ovum. If we can record them and identify them, it will ease our job and it will be reflected into the success of the outcome. So selecting the correct system, and in terms of calculating the cost, the artificial intelligence will have great contribution in reproductive medicine, we believe. So we collect data, and these data are continue to be collected. And for the ARTs, they need to be evaluated and validated. The centers are not very willing to do so. The centers are not very open to innovation. And if we can have collaboration at the highest level possible, then we can develop very nice applications, because there are very fast developments in the field of medicine and some good results are achieved. In the oocyte selection, still we don't have a very well-known artificial intelligence implementation. In 2018, Cavalera et al. Used a time-lapse microscope, and they used the particle image velocimetry method. So they collected the oocytes in terms of competent and incompetent, and they had the accuracy of 91%. So when we select the oocyte, we cannot use an invasive method. We should not be using that. So it should be non-invasive, inexpensive, and it should not distort the flow of work, because in the end, there is a workflow in a laboratory. So embryos are quite, the embryos are complicated processes. So, and of course, there is the pressure of success and time at many centers. And I mean, getting out of the box might not be so comfortable for these centers. And also, sperm cell classification is used in centers, but this is not shared as data, and they do not serve the AI. CASA system is used, computer-aided sperm analysis. It is a little bit more objective. However, according to the many studies of embryologists, different embryologists come up with different results. It is the same thing for embryo selection. Many different centers have given give different grades for the same embryos. So we have just the ground classification. We just evaluate them according to that classification. We don't have AI for embryo selection. And we only have this microscope that is produced in 2 places in the world. So in fact, using AI in the ART, we can prevent the multiple pregnancies. We can prevent some unwanted problems in the mother, like preeclampsia or some bleedings, hemorrhages of the mother. So as I said, in embryo selection, only time-lapse microscope is used at some centers. It's not very common. In fact, it's accepted, but it is not very common. Still, there are some question marks. Still, time-lapse microscopes there are some publications showing that the results with time-lapse are not so good. For instance, in 2007, it says that the morphokinetics can exclude the embryos with the lowest implantation potential. They say we can rule out the bad ones, but we cannot say that it is the with the lowest implantation potential, they say. So I'm out of my time, but in conclusion, I can say that in the prediction of IVF results, we have to share the data, and these data should be of high quality, absolutely, because in the end, if we cannot share good quality, high quality data, then the data burden of the AI will not be sound and healthy. So it will not be helpful for the forthcoming processes, which can cause some ethical problems, because there are some questions whether the information related to patients should be shared so openly, but it is a must, because in 2013 time-lapse microscope was developed, but technical assessment is still so subjective. It's completely based on individual experiences. So very high quality data should be collected, and some prospective studies should be planned, because what we have right now is all retrospective. So in conclusion, we can say that there are some prejudices, some ideas that distances both clinicians and patients from these ideas, but in the end we have to use this information and data for the good of the patient. Thank you. Thank you very much, Emine Özçınar. It was a very nice presentation. Do we have questions I would like to ask, but we are going beyond our time limitation. Maybe after the last presentation, we can invite the questions. However you like, Emine. Because I can see that there are some questions here. So maybe we can have the presentation of Berkem Ökten.
Birkaç cümle eklemek istedim.
I just want to add a couple of sentences here. Well, Berkem Ökten is one of the stars of the future, because he is young and talented, and he's very promising, and he's giving us hope for future. He is working in IVF as well as OBGYN. He's one of the promising physicians. So we are looking forward to your presentation.
Evet. Sanırım şimdi gelecek.
Evet.
Bu arada ben kısa bilgi vermek
Well,
istiyorum.
in the meantime, let me give you some information about our speaker from Yeditepe University Faculty of Medicine, graduated from Yeditepe University, and then in Trakya University finished his specialization in obstetrics and gynecology, and he's now actively working in Acıbadem Health Group. I think the slides are ready. You may start.
First of all, I would like to thank the chair and the organization committee for this great event. Today, I'll briefly highlight what waits us in the future from the obstetrics, gynecology, and reproductive medicine perspective. As we know, the technology grows exponentially, but now it's even more exponential than ever. The reason of it is that every branch of science, like computing, engineering, medicine, and so on, they're no longer separate, but all are nested within each other, which shapes our future. Well, this is a quote of Benjamin Franklin: "An ounce of prevention is worth a pound of cure." He said this in reference to fire safety, but I think it can be applied to health as well. So we can say that most of the innovations in the future will be based on preventive medicine. The Human Genome Project was completed in 2003 with the goal of identifying and mapping all of the genes of the human genome from both a physical and a functional standpoint. But the impact of it on health has only just begun by linking genes to human diseases and conditions. An explosion of identified genes like breast cancer and other cancer genes and their mutations will help identify patients who should receive more timely intervention that are designed specifically for their unique genomes. That means the ability to design patient-specific tailored therapy. So from gynecology point of view, let me summarize our situation right now. With the widely used of cervical smear tests, as you know, the mortality due to cervix cancer had reduced significantly in the last 40 years. And then Professor Hausen took it to the next step and demonstrated the connection between the human papillomavirus and cervical cancer, which led to development of HPV vaccines. And with his work on 2008, he was awarded with the Nobel Prize. So in the future, with these vaccines, we are talking about eradicating a cancer type with a high mortality rate. In near future, we will find causative agents of more cancers and witness the development of specific vaccines. So with the technological advancements, now we are able to analyze massive amount of genetic material, and that enables rapid, earlier, less invasive, and more accurate diagnosis. With this massive amount of data, now we can form panels of genes that are commonly mutated in certain cancers. Now there are studies showing that from the specimen we collect from the cervix with a brush, a routinely performed cervical smear test, we can isolate commonly mutated genes even related to endometrium and ovary. So we can diagnose ovarian cancer from a routine test. So the ability to detect circulating or shedded tumor DNA on routine tests instead of biopsy material means early detection of a pathology in less invasive fashion and also prevention. And of course, we use this knowledge and technology about genes in obstetrics to detect chromosomal problems in the fetus at very beginning of the gestation, even in 10th week of gestation. Now you can take a little blood sample from the mother and extract and analyze the DNA that belongs to the fetus from that sample and screen for specific chromosome anomalies with a non-invasive technique and with a high sensitivity rate. So in obstetrics, what else the future holds? One of the biggest challenges for us obstetricians is to prevent a preterm birth. Yet sometimes it's inevitable, and sometimes we decide to do emergency delivery in order to save the mother's or the fetus life. But in too early preterm births, like before the week of 23, 24, even with intensive care unit, we are unable to save the baby. So in 2017, a study by Emily Porridge was published on Nature Communications that provided the most successful demonstration of an artificial womb, an artificial uterus. These lambs you see in here were extremely premature, about 105 days old, which corresponds to 23 weeks of gestation in humans. So that is under viability limits. These liquid-filled plastic artificial wombs help these premature ships to develop for 4 more weeks. So the device acted like umbilical cord, providing fresh blood and nutrients to the fetus. Also, it kept the environment at the right temperature, let the sheep breathe through fluids, move and sleep, and so on. So in the future, it will help save the lives of extremely premature babies, meaning born before 23, 24 weeks of gestation, and also prevent them from having long-term medical issues later in life. And also that will, of course, help us obstetricians to have more free space to decide for emergency delivery in favor of the mother, because we will be able to maintain fetal maturation outside of the mother's uterus. So how about bioartificial organs? It's an interdisciplinary field consisting of an array of scientific technologies like biology and especially stem cells, materials, chemistry, physics, informatics, mechanics, computing, surgery, and so on. So it really is a technical and complicated issue which requires precise control over multiple heterogeneous cell types and material components. And also the detailed understanding of the human body is fundamental, intricate response to all environmental factors. Well, there are really good improvements about the topic, and the science of building stem cell regenerated organs such as urinary bladder offers great hope for replacement organs, but for uterus, there is still a long way to discover actually. to build up an organ which is responsive to hormones, which provides menstruation, and more than that, of course, grows up a fetus inside and expands way too much to maintain a pregnancy. Well, there are so many challenges ahead. Maybe not building up a whole bioartificial uterus yet, but stem cell regeneration of a defective uterus of an infertile woman is just on the way. And what else for obstetrics? I'm sorry. So there are Doppler devices that can be connected to your smartphone, which shows the heartbeat of your baby. And now portable ultrasounds are already on the market. But when these devices meet with an AI, artificial intelligence, that changes the whole situation, because you will need no skill, no education for ultrasound examination. The AI will guide you while you are holding the probe, and actually performing an ultrasound in your living room and seeing your baby doing the ultrasound yourself sounds cool, but the important thing with this innovation is that in remote areas where it's hard to reach a healthcare center, these instruments will instantly share the data with the healthcare provider and informs both the patient and the provider if there's an emergency situation, which may save lives. And AI and machine learning is useful for analyzing large heterogeneous data sets such as genomic or epigenomic data, as previously mentioned. Unsupervised learning utilizes uncategorized data sets to find hidden patterns or grouping data. And actually, this is so exciting about artificial intelligence. It will collect thousands of data and connects them with the results in a way that us humans can't see. So who knows, maybe the next Nobel Prize will go to an. So of course there still is some improvement. There still needs some improvements, but now prediction and detect labor and pregnancy complications specific patients. As the AI progresses and trains on real images, compare its diagnosis with real clinicians, it improves itself, and deep neural networks were used to train AI to make diagnosis of skin cancer and diabetic retinopathy, and AI performed just sometimes slightly better when compared to that. So again, as previous speakers mentioned, we are already using AI in reproductive medicine to select the embryos, mostly give rise to successful pregnancies. It's not at its best right now to be more data to be added in this data pool, but full control to select the best quality embryo and which one to transfer. And also there about sperm quality, as mentioned before. And of course, future is about minimal invasive surgery like laparoscopy, robotic surgery by augmented reality. The reality provides is that users do not lose touch with the reality. Well, there's a lot more to talk about the topic, like will there be unmanned full automated robots doing the surgery and etc. In not too distant future, maybe we will be talking about that as well. But what we know is that real creative, inclusive, and open research culture will unleash great discoveries. With listening, I would like to thank to Professor for this great event. Of course, Happy Mother's Day to all.
Thank you so much, Dr. Ökten. It was amazing presentation and marvelous futuristic ideas is coming in presentation. And so I think so we have some very small movie from the technical team. And then after this movie, we have some explanation for the Dr. Ökten and the other presenters.
Thank you.
Merhaba. tabii severek aslında bir konferans değil, büyük bir dünya kongresi.
Evet. Evet, kongresi.
And
Aslında biraz
the
önceki
previous participant from Adana, I had the chance to listen to him
tabii
in your
takipteyim. Daha
program
önceki İkizlere
because it is
katliamını
something
dinledim.
that you discussed there. The subject that I'll talk about here has something to do with
Anlatacağım
this
konunun
interesting
biraz bunlarla da ilgisi
coincidence.
var. Belki çok
In
ilginç bir
fact,
tesadüf.
this is
Aslında
something
hep
which I always
şikayet
complain
ettiğim bir şey.
about. I have to say that Turkish people are very
Pratik
practical and they
ve
tend to work
günlük
on a
yaşayan
daily
bir
basis. We
geleceği
tend to work on planning for the future. Since that is the
bundan
case, we have such problems.
İkizdere
Ikizdere
ve
and
güzel
our
yaşamımızdan
beautiful
farklı değil
Adana
aslında değineceğim
going through the same
konu.
things referred
Şimdi
to right
elimizdeki
now, not being able
güzellikleri
that
fark
we have
etmemek,
at hand,
bunları
wasting
çok
them
kolay harcamak,
easily, letting
harcanmasına
people
izin
waste them
vermek.
easily, and just watching what is going on without responding to those are really things that we keep doing for a very long time. But I have to say that there is something good to talk about because people who have a national identity are really sad about this. So some sort of a way out should be shown to those people. I think this is going to set a very good example. I mean, the World Congress that I prepared for those people. One of the assets that we have is the traditional medicine education that we have in Turkey. And also we have this tendency to approach the medical issues that we have from a traditional perspective. This is classic medicine. The European law and ethics have been adopted by Turkey, but while doing that, we acted as the grandchildren of Ibn Sina as well, not only as the grandchildren of Hippocrates. This is going to continue like that, but unfortunately, we are failing in something. We keep saying that United States is the dream country. We should follow her, and we should see that as an example. And unfortunately, we are acting in an unconscious manner without being aware of the assets that we have domestically. I think that this is something which needs to be corrected, and that is going to be a very good opportunity to make that correction. When you say an IVF expert, who do you think is an IVF expert? How do you image that person, the medical doctor in that related clinic? Do you think this is a person who's an obstetrician? No, it's not an obstetrician. Very good to hear that from you. Very good to hear that from you. I'm not very competent on the subject, but you've given a very good example. You are a conscious Turkish citizen and a global person. Let me tell you why. The reason is that we have a very important asset at hand in Turkey. Only a few countries has that assets. We have a branch in medicine, a specialization name in Turkey, which is called embryology. China is making new initiatives in that sense. France, years ago, as the cradle of law and ethics, started to deal with the IVF matter, but suddenly Pasteur Institute said, no, if you're dealing with a new formation like that, and if you're talking about an embryo, you should first set down the ethics and the legal basis for that. As you know, the new inventions in medicine and science are like that. First, the invention is done, and then the legal regulations follow sluggishly and gradually in a way that is not capable enough to fulfill the daily needs. That is the same thing in IVF. As of today, in the United States, everybody can do everything. A 6-month certificate is enough for dealing with embryo with something that has the potential to turn into a human being. If you have that 6-month certificate, you can easily do microsurgery and microinjection. You will have the right to do that. In Asia, in Europe, and in Turkey, the special clinics, the private clinics are also doing the same thing. But we as Turkey have another chance. We know about the classic medicine. Therefore, we have medical doctors and specialist doctors who are working in the laboratories with that silent creature which cannot defend itself. And the only branch which can deal with that, who can address that, is the people who are graduates of departments of histology and embryology. Therefore, without knowing, we have an asset which we can deliver to the world, to the rest of the world. This Congress is going to make the rest of the world hear about this, right? Exactly. So this might be our starting point. Our health personnel is being neglected a lot these days. Therefore, those people are unfortunately neglecting their families, and they're justifying themselves with claps.
Bu çok yetersiz onlara destek olma
It
açısından.
is quite promising for them, encouraging for them. It's important to support the Turkish healthcare personnel. And this could be the Turkish model that we can introduce to the world. So we have the specialty. So we have legal and ethical experts, and this is a Turkish model that we can present. Because do you know what happens? In the United States, during the laboratory practices, when an embryologist does the IVF, and also the obstetricians cannot get into the laboratory, and IVF takes place in the laboratory to 90%. And when the person just loses the embryo, then there are hundreds of thousands of dollars of compensation, and the insurers are just waiting at the doors of these IVF centers. Therefore, in Turkey, at the Ministry of Health and at the Institute of Higher Education, thanks to this department, we have a model that can be presented as a role model to the world, because the institution is protected, the own experts are protected, because no one can be a director in these centers apart from these the graduates of these departments. So this International Congress of Future Medical Pioneers will be held on the 8th and 9th of May, right? Yes, it will be online. It has a very low fee of attendance, and it will not be only IVF to discuss at this Congress. We are going to talk about the medicine of 2 decades ahead. And the name itself is the Future Medical Pioneers. We are, you know that there are always professors that are well known are talking, but we will have the speakers from Africa, Japan, United States, and we'll have speakers speaking about their dreams, their imaginations, and it will not be on the medical. We'll talk about the legal and ethical aspects as well. And for the first time in an international congress, we're going to talk about the regulations as well. And also the results declaration of the Congress will be sent as a human rights declaration to Europe, and it will be taken as reference, it will be presented as a reference to the World Health Organization. That's great. Thank you, Professor. I hope that it will be of benefit to humanity and to all the people. So Professor Bahar Uslu talked about the International Congress of Future Medical Pioneers, which will be held on the 8th and 9th of May. You have the announcement on YouTube. Thank you very much. I wish you all the best. Thank you. Thank you very much.
Özellikle Oya Evirgen hocamızın bir sorusu
Well,
var.
Oya Emirgan has a question to the panelists. Well, with this ICSI method in the IVF circles, how these technological developments will affect the natural selection. So could we have your opinion on this, Mr. Ökten? Well, I don't have any clinical experience on this, but I think that we can refer this question to the other professors. Well, of course, this is an interesting question. I can talk about my own idea. It's very important that a scientist is concerned about future. I appreciate the concern about affecting future and nature, but as the technology develops, we are talking about the prevention of distortion of nature. And sometimes when technology eases our job, of course, sometimes it makes it more difficult. So what the panelists would like to say? Well, I read a publication on this. Well, as the central of the sperm will be used during the zygote and in the other divisions. So are we making the fertilization with distorted or damaged centrioles? And also they have come up with the result that is there any tendency for some neurological diseases, but these are not publications researched on a vast population of patients, but there are some concerns indeed. Well, in your presentation, there was a very nice point about artificial uterus and artificial organ treatments. So these are the dreams, but of course the reality requires some regulations because we cannot limit ourselves with just the scientific facts. We have to consider law and ethics as well. So, and Emine, in your presentation, particularly, you talked about the use of AI. So how can we find a good, proper oocyte or a sperm? Commonly, maybe that differentiation should be done according to race, age. The artificial intelligence, is it stuck? Are we at a bottleneck, or are we limited in terms of knowledge? By the way, this is going to be the topic of discussion of the next session. And also, in the last session, I really like the AI project of the students of Faculty of Medicine. So instead of waiting for the solutions, they are coming up with their own solutions. I think these developments are very nice. Well, in one of the studies, it is said that if we can share the high quality data, then maybe we can have the subclassification of the races, but we can have a much better assessment of embryonic cells. So after the cell scoring and embryo scoring is done, if we can match them with the results that we have, then we can develop very high quality data. In pathology, it is used, the AI is used very effectively. And it is one of the fields, I mean, the ART is one of the fields that we can use AI quite effectively, because we are still using the selection criteria from 1999. We have to go a little bit further than that. Okay, now I leave the floor to moderators. Thank you. Thank you very much. We have been quite happy to be with you, and greetings to Acıbadem, to Professor Cem. Thank you very much. We would like to see you among us in our next Congress. Thank you. Good evening.